Hi everyone, and welcome to today's webinar, A Safe Return to Youth Sports, What Families Should Know, brought to you by Sports Health at NYU Langone. Before we begin, please take a moment to mute your computer microphone or telephone. If you would like to submit a question to our speakers, please type it in the Q&A box on the bottom right corner of your screen, and we will try to answer as many questions later in the presentation. We will also record today's webinar, which will be published on our YouTube channel at youtube.com/NYULMC. I'm now pleased to introduce our panel of speakers. Drs. Dennis Cardone, orthopedic surgery and sports specialists and co-directors of the Center for Young Athletes. Dr. Sasha Gifford, a pediatric emergency medicine specialist. Dr. Purvi Parikh, a pediatric allergy, immunology, and infectious disease specialist. Jacqueline Tierney, an athletic trainer at NYU Winthrop Hospital. And Lee Eigel, clinical professor at NYU Tisch Institute for Global and an associate at NYU Grossman School of Medicine Division of Medical Ethics. Welcome, and thank you all for leading today's discussion.
All right, fantastic. We are so excited to have you all join us. We have assembled a rock star panel to try to answer all your questions, and really hopefully we'll just learn from this discussion. Before we get started, I'd like to preface the webinar by making a few points. The first is that the concept of this session is that of a focused discussion, which involves a multidisciplinary group of panelists with expertise in pediatric sports medicine, immunology, emergency medicine, and bioethics, just as you heard. The goal is to provide a framework for participants for use in making decisions for ourselves, for our kids, our families, and our communities as we think about returning young athletes to sports participation. Members of this panel have provided clinical care to patients infected with and affected by COVID-19, and many of us also work with local schools and larger national sports organizations that are tackling these very questions. And we will draw from these experiences throughout our discussion. And then lastly, as you all well know, one of the particular challenges regarding COVID-19 is the rapidly growing and sometimes contradictory scientific data that underpin clinical and public health decision-making. So today, we'll discuss the most up-to-date evidence while acknowledging that our thinking may evolve as our collective experience with COVID-19 grows. And with that, I think we should go to our first question. Would you please advance the slide? Perfect. So let's see here. I just need to make my screen a little bit bigger so I can read that. So in the event that we get the green light that our kids can return to sport, what are some of the first steps that parents should take? And I think this will be a great one for Jackie to start with. Jackie, please go ahead.
Hi, everyone. So the big thing, the first thing you're going to take is you're going to weigh your risk and reward. Is it safe for your family to have kids return to their athletics? You have family members that are high risk, or are they a high risk athlete? And then you're going to decide whether you're going to play or not. Next, you're going to go over the league and team protocols that are in place. So they start having check-ins, wearing masks, different guidelines, just starting off in small group practices versus and the whole team there. You're going to follow those. You want to start slow. Don't go too hard, too fast, and watch out for any kind of injuries or illnesses that can come with that. And then, as Dr. Carter stated before, things are changing rapidly. So you're going to be flexible and try to have an open line of communication and listen to coaches, league officials, teams, and listen to your kids athletes themselves.
Awesome. Awesome. Thanks. Thank you. So, I would say to that, that I think, well, the goal is to avoid infections for kids who then bring infections home, right? And then infections for anybody associated with the team, be that coaches or, if the locker room is involved, even like janitorial staff. So I think just in terms of putting together a framework, how can we think about avoiding infection for individuals, families, and communities? And then, as you mentioned, which is something we are already, I think, starting to see, and Dennis and I can talk about this more, but then for our individual athletes, how do we avoid injuries for kids who haven't been doing a whole heck of a lot and certainly haven't been preparing to be physically active at the level which, at which they're accustomed to? How can we make sure that they're able to return safely from not just an infectious standpoint, from a musculoskeletal standpoint as well? Does anybody else have things they want to add to that?
Yeah, I think it's very important to, when parents are thinking about having their children return back to sport, also a good conversation with league officials and coaches, right? How prepared are they in this COVID environment? That would be number one. Are they taking all the precautions that need to be taken? Certainly that's very key. How serious do they take it? What are some rules and regulations about play, about practice, about transport? To and from games, and we'll talk about more of that later. And then, of course, things that you alluded to, Cordelia, about prevention of injury, and we should talk more about that too. These are children, adolescents who have not done potentially activity for an extended period of time. And besides our big concern and worry about COVID, is that big concern and worry about other injuries because they haven't been participating in sport.
I hear you saying the first step really is to ask questions, right? Make sure that, whomever is going to be in charge of that team or that league has a plan in place that is reflective of local epidemiology and local guidelines. I think that's probably the first thing to do. And then I think Sasha has something to add. Go ahead.
Yeah. So I love what Jackie said about doing a risk assessment before going into playing sports, a risk assessment for not only the child, but also the family. The CDC has actual conditions that they list as being people who are at increased risk for a severe COVID-19 infection. And they list these things as being chronic kidney disease, COPD, being in an immunocompromised state, obesity, sickle cell, and type 2 diabetes. So all of those conditions have been proven to have the people who have those pre-existing conditions and contract COVID-19, they are at an increased risk of severe disease with COVID-19. And then there are diseases that are listed that theoretically could, these children and families, they could have an increased risk. And those things are asthma, cystic fibrosis, pulmonary fibrosis, people who are smokers, people who have thalassemia, and type 1 diabetes. So I think looking into those, looking internally and saying, oh, do my children have any of these diseases? Do I have any of these diseases? Do anyone in our family or immediate circle have these conditions? And really make that risk assessment. And it's not only for these conditions, but different states have different prevalence. And so really checking in with those local epidemiological factors, and also looking at each individual sport, because each individual sport has a different risk. And I think we'll get into that a little bit later.
So Sasha, the one thing that I would ask would, I know in the adult population, certainly all of those comorbidities that you spoke about and problems lead, equals potential increased severity of disease with COVID. Is that absolute with children and adolescent population as well?
So looking into the CDC guidelines, they list all of the medical conditions. The ones that I listed first are at increased risk at any age. So any individual with those comorbidities, I think no matter the age, will have an increased risk of severe illness. But we have been seeing children obviously are not as affected as our adult population, and that's to be taken into consideration too. And I think it's just also important that to note that these children could be vectors of infection for people who are living in the household, and that's also an important thing to take into consideration.
Perfect. I think, so what I just heard everybody say was do a risk assessment, right? Do a personal risk assessment. Or do you have a pre-existing condition? Does your child have a pre-existing condition that may put them at a higher risk for contraction or severity of the illness? Do as well like a community and local risk assessment. What does this look like? So I think, and then actually, Lee, I was thinking that it might be interesting also to have you comment on this one, if you wouldn't mind, because I think something that parents might not think about as much as what would their liability be, right? If their child does contract COVID-19, and then unwittingly spreads it. You're on mute.
There we go. So that's a question that opens up a whole bunch of discussion. I think people are already seeing it at the college level, especially with the sports, but at the younger ages, you know, the question of liability gets into something that I want to discuss later, which is waivers. And that, when we start to whittle it down, is really just about who's taking responsibility. And the tough thing about it is that sports organizations can't offload the responsibility to parents and to children. This is not a moment to do that. There's too much that parents and children don't know about COVID. There's too much misinformation out there. It's a terrific opportunity for our sports organizations to educate people, but it's one moment where liability, without getting too much into the law, which is not an area that I'm depth enough to read through, but enough to understand that because we don't really have any experience with COVID running through the court systems, the idea of signing a waiver and going, okay, now parents and kids, you're liable, is, I'll put it a polite way, it's nuts and it's dangerous. And organizations ought to get further away from that and much closer to educating people.
Thank you for that. So we've had a question from the audience, from one of our participants, and anybody who wants to field this one, just put your hand up and I'll call on you. So what happens if one of your kids' teammates tests positive for COVID? What are the next steps? What should you as a parent do? Super, Purvi.
So yeah, this question is going to come up a lot, not just for sport, but pretty much any interaction with other people. So ideally, if someone does test positive, the recommendations are, whoever has been in contact with that person, within the last week to even 2 weeks, in the last 14 days, should also be tested. So that includes, all the teammates, whoever lives at home. That includes parents, grandparents, because again, it is a highly contagious virus, and this is all part of what we call the contact tracing. So people will have to be notified and either tested, or they can opt to quarantine themselves, for 14 days from the last contact with that individual who is positive.
Super. All right, let's go to the next question, please. So what do we need to do if a child was previously sick with COVID-19 and is now ready to return to sport, or feels ready? Let's start with that first part of that question stem. So let's see. Anybody want to take that one to start?
Well, you know what, I could certainly start with that one. And, as we're learning more about the COVID virus, there have been concerns about, especially an older population, but now we're seeing recommendations even for the high school and collegiate athlete about return to sport after COVID-19. And even for athletes or individuals that we talk about who potentially were even asymptomatic, were just COVID positive, there should be some kind of formal clearance to get back to sport and activity. So we know at a minimum there should be, if somebody tests positive for COVID and they're asymptomatic, there should be at least 10 days of no exercise from the time they did tested positive. But if they were symptomatic, or again, even asymptomatic, the concern and the growing concern is complications, especially related to the heart and the cardiac system. The NCAA just came out with guidelines that recommended a complete cardiac workup for athletes that do test positive. That would include, in most cases, an EKG and an echocardiogram. And we're probably, or may start to see these recommendations in our younger athletes as well. So the virus can affect the heart. There's something called myocarditis. It's still unclear what population will be at risk for this and how much it will affect our younger athletes. But we do know certainly in our older athletes, that this is a big concern. So as we're seeing this return to sport, we're going to learn much more about it. But anyone who has tested positive for COVID-19 absolutely should go through the proper steps, have an evaluation by a physician, and make sure, especially to have some screening for these cardiac and maybe even pulmonary complications.
I just want to clarify. So this is even for somebody who has asymptomatically tested positive. You would still recommend an in-person, hands-on physical examination, and then probably also EKG and/or echocardiogram.
So it's a really great question, and again, the recommendations are changing, very, very quickly before us. So anyone who tests positive, even if they're asymptomatic, they should have an evaluation by a healthcare professional, even if it's just a good questionnaire to see if they had any symptoms. What are they feeling like now? Have they had what do they feel like when they're even exerting themselves with walking? Are they having any changes? Again, for our collegiate athletes at this point, the recommendation is that they do have an EKG and an echocardiogram if they tested positive. We don't have strong recommendations. I'd like to hear from the rest of the panel for our younger population at this point, but it seems to be evolving, and it may be a concern, again, even in our youth adolescent population, certainly to at least have a face-to-face evaluation with a healthcare professional.
Well, I want to follow up before I call on anybody else, because I also want to clarify. So is somebody who is asymptomatic, a child who's asymptomatic, you would also recommend 10 days of abstinence from exercise?
Yes.
And what's the concern with that? What if they say, hey, doc, I feel fine?
Right. No, and exactly, they're asymptomatic, right? But here's that concern. Even though they feel fine, we know potentially that the virus can affect the heart, for example, like we're talking about, or the pulmonary system. And when a virus, and there are other viruses too that have what we call a predilection, say, for the heart, they may be asymptomatic, but they're at increased risk maybe for potential complications related to the virus. So even though they're asymptomatic, they should not exert themselves strenuously for 10 days.
Got it. Purvi or Sasha, do you have something to add that you'd like to add?
No, I would agree. There should definitely be some form of clearance by a physician before they return, especially because even if they are asymptomatic and may not have any other underlying health conditions, they might be interacting with other teammates who do, and those teammates, may have family members that do. So I definitely do agree with those recommendations. There may even be a need for, testing to become negative as well before they return back, which I know might be complicated logistically, because some positives can last for quite some time. And as we all know, there are a lot of delays, unfortunately, in the tests being resulted.
And I also agree with what Dr. Cardone is saying. There's been several papers that have been published, one being in JAMA Cardiology back in May, and they outlined what Dr. Cardone was saying, how if you are COVID-19 positive and you break it up into 3 tiers, asymptomatic, mildly symptomatic, and then significant symptoms requiring hospitalization. Your asymptomatic people who test positive, they'll definitely need to be monitored with no exercise and then slow resumption to activity. Your mild symptomatic children should have a full evaluation by a medical provider, and then have those things like an EKG, perhaps an echocardiogram, and a troponin, which is an enzyme made by the heart, and it's a marker of cardiac inflammation. So there's also, and then if you are significant symptoms and you have been hospitalized, or you have also been diagnosed with multi-system inflammatory syndrome in children, also known as MISC, then you should have an even full, a more in-depth evaluation by a pediatric cardiologist and have advanced imaging of the heart. And if any of those things are abnormal, then the recommendation would be to follow the myocarditis return to play guidelines, and that will put an athlete out for about 2 to 3 months out of play if they meet those requirements.
Got it. I have two comments to this. The first is that, fortunately for the vast majority of kids, at least in our, and correct me if I'm wrong, but at least in our experience thus far, we're not getting to the systemic inflammatory, multi-system inflammatory. We're not getting to the, active myocarditis. And so, while this is what we're focusing on, this is because these are the most feared complications and the things that might, I think, really impact or help our thinking about a return to sport. The second comment is that we have had an expert phone in who is attending. So thank you, Julia, who's an athletic trainer who works with us and has been really rigorously reviewing all of the existing policies. And so she wanted me to note for everybody that actually the NCAA policy says that people who are asymptomatic can exercise. And so this can be confusing for parents if you read this statement and then there's other recommendations not to exercise if you have even an asymptomatic COVID-19 positive test. But so perhaps if a parent, if you as a parent are able to exercise with your kid and closely monitor to ensure that truly asymptomatic and maybe certainly dial down the level of activity, that maybe that's a way to safely do it or to mitigate some risk. But I think this is a really great example of how, their policies can be conflicting because, we're constantly learning, and it's that constantly shifting framework that informs our decisions and recommendations. Does anybody have anything they want to add to that?
I just wanted to add actually to those points, this is really that kind of heads up worrying area, because if you think about the regular pressures of return to play when it comes to sport, we start to get into all those discussions. The coach wants the kid back on the field, the kid wants to get back on the field, the parents, we start to get into these kinds of things. And this is, I think we all know, this is a different game we're playing than even concussions and that whole discussion. So this is a really worrying area. That pressure to get back out there, especially if these are asymptomatic, is something we're really going to have to look out for. Not so easy. Nice to talk about, but not so easy once somebody says play ball.
I agree. Well, so let's look at this second question, because this is, because many kids, at least in my practice, do have asthma, and oftentimes it's actually exercise induced. And so, knowing that COVID-19 is something that, in addition to the cardiovascular system, which we've discussed, even maybe primarily affects the pulmonary or the lungs. So what about a child with asthma or a different pre-existing medical condition? Do we have to do something different to make sure that they're ready to participate? I think I'll throw this to, oh, sure. Yeah, Purvi, please.
Oh, no, sorry. I was just going to jump in because as an asthma specialist, I get this question almost every day, not just for sport, but for school as well. So the important asthma is its control. And even with COVID-19, those asthmatics who were well controlled fared far better than those who were uncontrolled. And of course, other comorbidities go into it as well. But definitely any child with asthma does need clearance from their asthma specialist. One, review of medications, make sure it's safe for them to return. Again, risk versus benefit. I would give a different recommendation to one of my severe or uncontrolled asthmatics versus one of mine that may rarely get symptoms. And then further workup may be needed as well. So that includes either a spirometry or pulmonary function test, and even possibly a chest x-ray. And that may even underscore, what was discussed in the previous question, that if you have some type of underlying lung condition, not just asthma, that pulmonary workup may be needed as well for clearance, even without symptoms, because of all of the reasons we mentioned before. And I would think the same for other pre-existing conditions as well. You would want those physicians to weigh in, make sure they're well controlled, and make sure it is safe for them to go back. One asthmatic, it might be, and in another, we may decide, okay, not yet.
Got it. Jackie, do you have anything to, I was going to say, do you have anything to add to that? Are you carrying anything different in your bag? We used to have like a rescue inhaler for every kid that had asthma, like just in case. Please go ahead.
Right, so we will carry that, but just from the National Federation of High School Athletics, what they're recommending is, people with asthma or pre-existing medical conditions, a they can come back, but they may want to wait. So right now the recommendation is to have phased openings for sports. So start with the small groups and then move into half teams and then full teams. And they're saying maybe those athletes may want to wait until they figure out, okay, it's safer to come in now, 4 weeks later or 3 weeks later, let everything calm down, make sure there's no outbreaks on the team or anything like that, and have them come in late.
Terrific. Thank you. I think let's go to the next slide, please. It's to have contact and play if kids wear masks. What can we do to ensure their health and safety? Will this vary depending on sport? So that's a question with lots of different, I think, avenues that we can go down. So to me, we're really talking about like football, basketball, maybe lacrosse, some of the contact sports. So, and that is alluding to, and so anybody please chime in with this, that, you know, baseball played outdoors, which is inherently socially distanced, and outdoors, you know, is probably a great first bet in terms of like how to roll out returning to sports versus maybe football or basketball, which really are inherently in your face sports. So does somebody want to start with this, or if not, I will just choose.
Yeah, no, I think it's a really good point, right? I mean, there's certain sports certainly that you cannot, or the recommendation is not to wear masks, and there's concern that it's actually could be dangerous, especially for some of the contact sports, to wear masks, and it certainly would not be well tolerated. And, you know, I'm sure, as we all know, they would be all over the face, and except maybe where they need to be. So with contact sports, and even for most, you know, for many of the outdoor sports, you know, it's not necessarily a strong recommendation regarding masks. Certainly, you know, sports should be, as much as possible, we should be pushing for them to be outdoors. But any activities that are moved to the indoors, whether it's working in some kind of weight training room or any indoor sports, as much as we frown upon them right now, those are certainly areas where masks should be worn if possible at all times. But when we talk about the high contact type sports, really not with masks, but other sports. And as soon as the children, athletes hit the sideline, they're on the bench or they're talking with the coach, there should be masks on, and certainly coaches and spectators should always have masks on.
We had a question for the audience earlier, and is there other PPE that a parent who is attending a game or a spectator or a coach should be wearing besides a mask? Anybody?
So social distancing and mask.
Yeah.
And good hand hygiene.
Yeah.
Right.
All of the general recommendations. I agree. So Sasha, I'm hoping that you are the expert on this, because something caught my attention recently about the neck gaiters that I see lots and lots of people running in. What is the latest data on that, please?
Yeah, so there was a very interesting article that was recently published, I think just last week, and it basically looked at several different masks. They tested 14 different masks, and then they set up this really cool experiment with a light box and a laser, and they were able to look at the particles that were produced actually just from simple speech, not even breathing or coughing, but just from speaking. And they tested the masks against each other. And some of the masks that they had were an N95, which tested excellent, a surgical mask, which tested just a little bit worse than the N95, but did very well. And then most interestingly was the fleece and neck gaiter, which we often see, you know, we're in New York City seeing people running around in the city in these neck gaiters, these masks that cover the neck and the mouth, and they're one ply material of cloth. And the study actually showed that when speaking through this material, it actually changed the large droplets that were being produced in speech to actually smaller particles. And the problem with smaller particles are that they are aerosolized and they stay in the air for longer. And so this study basically recommends or suggests that possibly the neck gaiter is maybe worse off than just than not wearing a mask or wearing a different mask, such as a surgical mask, or the next best one was a cotton, polypropylene cotton mask.
I think that's really helpful. We've gotten that question in the past, is like, what is the best one to wear? And I think something that's, just like you said, something that's breathable, but I think a lot of and athletes especially have taken to wearing the neck gaiters. And there are some data now that tell us that maybe they're actually worse than not effective, but actually potentially, making it even more dangerous. A question just came in. So with that specific article that we're talking about, so hopefully you read it really closely.
Yeah.
What limitations are there? Because just like, we try very hard to do good research, we as a scientific community that is peer reviewed, and that is inherently slow. And so I think that COVID-19 has given us, we're trying to understand it as quickly as we can. But then that has resulted in some retractions. And so what limitations are there for this article, just so everybody can sort of take it with a grain of salt?
Yeah, and I think, it should be taken with a grain of salt. I think it's a very interesting study, and it can lead to further studies in this area. But I think one of the major limitations of the study is that you're not testing directly like COVID-19 virons in this study. It's just basically the visual representation of speech with a mask and without. Also, they had like a small light box. It doesn't really take into consideration breathing outside or in a well-ventilated area. So there definitely limitations to this study, and we are in need of further studies. And I think this study was so interesting that I'm sure that there's going to be a breadth of research following this. But always important to to read things very closely and to look at the limitations. But I think it's an interesting topic.
Yeah, I agree. Jackie, can you speak to managing PPE for kids? So for example, a baseball team, is every kid going to be seated on a bench 6 feet away, playing with, are they going to each have their own bat? What is the recommendation for managing PPE for various sports at this point?
So more for equipment-wise for sports, it is recommended right now for everyone to have their own equipment, have your own helmet, have your own bat. You can't do that, sanitary regulations. Wipe it down after every use. If it is your own equipment, bring it home after every practice. Wipe it down. Don't leave it in the bag or anything like that. Actually do the wash at the time. I know athletes are a week later and they still have their uniforms in the bag. But we're going to really focus on hygiene now. Mask on if you're on the bench. If you're not playing, mask up, mask on. 6 feet is great, but sometimes it does get crowded in the dugout in baseball. So that's not possible. It's mask up.
Super. Leah, I think this one might be for you. This is an interesting question. So this is one of our participants said, maybe this is beyond the scope, but as a coach, any tips on how to deal with other coaches that think this is a hoax? So basically, how can we get everybody to buy into this? So this person's a cross country coach, wants to make sure everybody's able to participate and speaking to low and high risk sports cross country, as long as we do a staggered start, not a clump start right at the beginning, should probably be one of the lower risk sports. But so, how can we get everybody to buy into this so that it is safe for everybody and we're able to maintain it that way?
I think we're dealing with a question about someone who thinks that all this is a hoax. We're all dealing with that, and we get into the business, I think, of just doing what we can to manage the conversation among. But for coaches, they have to manage the conversation among their players and their athletes, and that's as far as it can go. In the sense that I think engaging in these kinds of conversations with someone who thinks that this is a hoax, it's a joke, it's like fake news, not even in a political way, just in a scientific way, is just not. It's just not going to go anywhere, and it's not worth the time doing it. Coaches need to be ready, if it's the case, to pull their teams, and that's okay. They've got to get into a sense that the sport is going to be different, and that's okay. It's okay for a little while that it's different. Training might be different than it was. Games might be different than they were. And coaches are going to need to figure that out too. As we know, there are always coaches who, somebody who thinks it's a hoax is probably the coach, most likely the coach who's saying that kids have to get in the game after they've got an evident head injury. I'm sort of putting them in the same category, and you've got to manage the situation, be ready to leave the field.
Yeah, I agree. I mean, I also think this is a great time for parents to be advocates for their kids, right? I mean, I think the first thing we said to do was ask questions. So, who's going to be caring for your child, be it the coach, the athletic trainer, who's the ones making the decisions? And I think it's okay to ask them, what information are they using to base decision making, and how are they updating that? I mean, I think asking those questions from the start is going to hold coaches accountable as well. And that's a good way to start being an advocate for your kid, to be able to participate, but to be able to do so safely.
Yeah, and if I just follow up to that, actually a neighbor of mine was telling me her son plays baseball, and there was no community baseball, but he plays fortunate enough to play on a travel team, and everybody else was going, and his family felt like they weren't comfortable enough with it was between social distancing and mask wearing and other things to let him go, and they finally relented. Said, you know what, we're not going to stay away anywhere. We'll drive to wherever. And this is very fortunate sort of example, but we'll drive the couple hours to the game, go play the game, keep your distance, use your bat, hand wash, all the precautions. And at the end of the day, we're going to go home. And that's really the trade-off. If, son, if you want, or daughter, if you want to play this sport, we're going to have to do those things. Now, granted, there are a bunch of too many situations and circumstances where parents don't have that kind of fortune and can't make those decisions. They want their kids to play. They don't. The means aren't there to make a 2-hour drive there and back. But you can start to play with all these different angles of it. I think the end point is parents really need to think, as you said, about being advocates for their kids, and this is not just sort of the fun and games that we're all used to. It's a whole different story.
I think it's still fun and games. It's just with more rules.
But that's not fun and games. But I'm with. Still have fun playing the games.
Right.
New rules.
Right. Perfect. Let's go to the next slide, please. All right, my daughter is a soccer player who has not been able to practice or play over the last few months. How can we help her restart training while still preventing injury? Dennis, this has your name all over it.
Yeah, such a great question. The first thing that comes to mind immediately is one thing that we always pitch is ACL prevention programs. And I think this is a great way to introduce those programs, as well as getting an athlete back to conditioning. So whether it's a daughter or a son, those programs are easily accessible online. There's a few programs that we could talk about, but they're just wonderful, wonderful programs, because we need to take into account these athletes have been doing anything potentially for months. There's muscle imbalance, there's muscle weakness, or a setup for injury. And one of the ones, again, that we're always so concerned about are these ACL injuries, especially in our female athletes. So these are great, great programs to introduce, jumping again, muscle strengthening programs. And then in addition to that, would be a gradually progressive aerobic type program. But I think these ACL prevention programs are a great place to start. And really, education, we talk about that as well. And this is where parents speaking to coaches can also introduce this to coaches if they're not aware of it.
I agree. I mean, I think the first part is setting expectations for kids. Like, this is the first time that they've been inactive for any sort of real duration for this amount of time. And so, I think the expectation is really like, hey, let's go. I'm going to be able to go for the same duration, intensity, frequency that I used to be able to do. And so I think actually with kids, it's managing those expectations that, to be safe, it's going to have to be, as you just said, a little bit more gradual. And that actually they're going to have to do some training work to get back into sport and like rebuild that foundation, because And we're already seeing some ACL injuries. I've been seeing a lot of patellar dislocations, but also, and Sasha, you can chime in here too. But I mean, I can't tell you how many sentences in the office have started with, I hadn't done anything athletic, you know, and the first day back, I fell and broke my wrist, or I, you know, fell and twisted my ankle, or whatever it is. I mean, I think first we have to recognize that actually there, you know, that there is a real risk to a musculoskeletal injury by not preparing because of this sort of lengthy period of less activity. So I think we have to recognize that. I think we have to and make sure that kids kind of understand that, and then I think we can guide them with a gradual return to sports and physical activity. And so I oftentimes say, if you live near a track, you start out by running a lap, walking a lap. You know, if you do it for 10 minutes the first time, you add, you know, maybe 5 minutes the next. So, you know, and everything is gradual. You don't run every day. You have to have some good variety. And then, you know, some of the programs that were just mentioned, one's available. It's free online. It's the FIFA 11 Plus. That's specifically an ACL prevention program that's been demonstrated to minimize those injuries, but also just all lower extremity injuries. And it's something that, you know, you can do with your kids at home. So to me, that's how I would answer this. Does anybody else have something they want to add?
You know, it's kind of interesting because one of the most common problems that we see in young athletes is that kneecap problem, patellofemoral syndrome. And it's really about a muscle imbalance. And now from athletes not doing anything, I'm seeing them come in the office with this patellofemoral syndrome, this muscle imbalance, where they've been active prior to COVID. And now that they have these few months of not being active, you know, again, they're set up for even a little bit more of what we'd even consider an overuse type problem, even our younger athletes.
I think that's a good point. Yes, we're all a little bit deconditioned, and we just have to, it's just going to take a little bit of time and effort to undo that. And it's not, and we'll be able to do it, but just recognizing that it needs to be done, I think, is important. We have a couple of questions. One was, can you recommend one of the ACL programs? I do think the FIFA 11 Plus is a good one. Dennis, do you have others that you recommend?
I like that one. There's the California program, the PEP program, right? The PEP program. So that's also a nice one, but probably the FIFA 11 Plus.
The one he's referring to, it's the performance what is it? Performance. All right, it's called PEP. I think it's performance enhancement and I don't know, prevention of injury, something like that. The PEP program. Bert Mandelbaum is the one who really piloted and pioneered that one. Let's see. How long do you recommend that an athlete condition prior to playing in a game? Dennis?
Wow, condition prior to playing a game. That's a tough one, right? It really depends a little bit on age and sport and activity that they're doing, you know, but usually, you know, it's kind of interesting because when it's much easier to, or much quicker to lose your conditioning than it is to get it back, right? Meaning it takes longer to get back to that same level. So if someone really hasn't been doing anything over a period of months, let's say, you know, certainly the minimum is going to be over a period of 2 to 3 weeks, and 2 is really pushing the envelope a little bit. But, you know, the younger the athlete, potentially you can make some argument a little bit earlier. But, you know, there's even another program, I think it's the 50, 30, 20, 10, where you do the first week 50% of where you were at before the layoff. The second week you're at, you know, 70%, then 80, you know, et cetera. So there are different programs, but you probably have to look out over a period of at least somewhere between 2 to 3 weeks.
I would say even longer than that. I mean, I would extrapolate from kids who, you know, a kid who breaks, say like you have a 13-year-old kid who breaks his ankle and is in a cast and using crutches for 6 weeks. That to me, that's once that cast comes off, that's another at least 6, but maybe even up to another 10 weeks before they're really back to soccer, right? So 6 weeks out, at least 6 weeks to get back in. So I think 2 to 3 weeks is probably the very minimum, and don't be surprised or disappointed or frustrated, I think, if it's a little bit longer than that. We've had a request to send some links. I do know for the last webinar that we did, we were able to post some things after, and so we can post links, including the California, the Bert Mandelbaum PEP program. And there's a sports metrics is another one that has been demonstrated to be effective. there's one more question before we move on to the next slide, and that is it okay to carpool with other players on the team? I'm going to throw my hands up and point at one of you guys. I don't know the answer.
So I will say the general recommendation that you'll read when you look at schools and carpooling is it should be 50% of the maximum that the car holds. But the important takeaway here is masks. Absolutely, everyone should be in a mask in a car. Windows should be open for good ventilation, and I would try to carpool as little as possible.
Yeah, I think so too.
Yeah, I would agree with that.
Okay, let's go to the next slide, please. Will families and friends be able to watch games indoors or on the field? Are there spectator rules that we will need to abide by? I'll throw this to the group.
I would say yes. We're seeing this even with professional sports. It's extremely limited who can attend games, who can interact. Just speaking from the professional sports leagues, the ones that are the most successful, like the NBA, have really limited who goes in and out of their bubble, and while with school sports, we can't have a similar bubble, but I think it will be very limited and likely maybe just 1 or 2 at max, people accompanying a child to a game. And again, all the same rules, distance sitting, mask wearing, hand hygiene, because the less people that you can bring in, the less likely there is for any transmission.
There's this one sort of dovetails on what we've talked about earlier with travel teams. So is it safe to play teams outside the community, if you're really traveling outside your community or even to another state? What's the latest thinking on this, or how would you counsel parents?
Well, I mean, oh, sorry, go ahead.
No, please.
No, I was just saying traveling adds another layer of complexity to it, especially for teams traveling together. Again, I would recommend that people take their own transportation, limit the carpooling as well, because again, it's very difficult to distance yourself, especially when you're in an enclosed space for multiple hours at a time. That's why, air travel is considered one of the higher risk transmission activities. So I think it adds a whole nother level. And then, screening measures for other teams also have to be taken into account. I think we may not want to rush to that initially.
I think, I think the point you're making, I think, is that what we've also sort of what I think something that goes along with all of these is know your local epidemiology, right? Because you can only control what you can control. As soon as you start making that bubble bigger and bigger, you start to lose control. Right. And then and so one way to at least maintain control is to keep yourself informed. So maybe if you knew what the local epidemiology was the team where you were playing, and you also knew that it was low, then all of these things get put together. But so I think ask questions, know that the field is constantly changing, and try to know, the latest stats. And that I think those are the things that will help make decisions like this one.
And be flexible too. I mean, New York went from being one of the worst places to now one of the best places, right? So be prepared, things can change very quickly.
Yeah. All right, let's go to the next slide, please. Will parents need to sign waivers releasing the league or organization from liability before allowing athletes to participate? This one, Lee, this has your name written all over it.
Yeah, thanks again. I think to an earlier point, sure, parents are probably going to need to sign waivers, but that doesn't mean that leagues and organizations are free from liability. It doesn't mean they're free from responsibility. So waivers are going to be coming. They're going to, they might even be called something else. We've seen that in a bunch of different places. Certainly in some places they're kind of called codes of conduct, but they're essentially waivers. So get ready for sure to be flashed in front of people's faces, maybe paper version or more likely. We were headed toward before the pandemic, online apps, but parents are going to sign them if they want their kids to play, and then what happens after that is a whole lot of it depends.
I think that's, does anybody else have anything to add or just thinking about waivers? Or I think it's an interesting question. I don't think we really know their value, you know, whether they're going to do it, have their stated purpose, whether they'll be able to achieve that.
I think when you look back, and Lee could certainly speak to this better, but you know, when you look back at these signed liability waivers, they don't hold up. So they really don't make sense. You know, if we look at them again with our high school and collegiate athletes and with certain problems like cardiac problems, cardiomyopathies, you know, this has always been an issue in these liability waivers. And you know, in one sense, they really turn out to be a waste and really don't have value.
All right, let's go to the next question, please. Oh, that was the last one. Yeah, you know, one question that we glossed over, but I think we could answer in more detail that has come in. So let's talk about what's a low risk sport, what's a high risk sport, like what, just in terms of thinking about like what makes a sport higher risk or lower risk. And so, you know, if you felt like you were sort of ready to have your kids start again, but you wanted to do it at maybe the least risky way, how would you approach this? Actually, Jackie, we can start with you with this one.
So definitely. So with low risk and high risk, a lot of questions can contact, how close you are to the other players or other teams. So right now, our high risk sports are going to be hockey, football, because they're going to contact. Then there's the moderate risk where soccer is, you know, you can space out more, but you're still using shared equipment and the ball. And then you have your low risk, your cross country, your golf, where you're basically, you mask up and you're alone. So those are the three levels of sports that are out there right now.
I think that's a good one. Does anybody, let's see, I don't see more questions. I don't think we've missed any more questions that have come in.
Just one thing on the high risk, low risk. I'm also interested for parents and kids to ask, you know, what's the actual activity? I think there's a lot of assumption that it's going to be getting into practices and eventually games, and that's fair, but it's really about what's the activity. It's possible to do soccer activities that are spaced out and low risk, and then there are cross country ones that are high risk. If you're running in a pack, that could be a problem. So we really need to take a look and see what's the actual activity that people are engaging in.
Right. I think outdoor versus indoor plays a big role as well, you know, given the ventilation and whatnot.
I think that's a really good point. And so we did get a question about that. So what would your recommendations be for an indoor track and field facility that's reopening? Is that, how can we make that safe, or as safe as possible? What can we do to at least mitigate risk?
Well, you know, one, I would want to know, you know, if that indoor facility was taking any precautions regarding ventilation. And again, you know, it doesn't have to be anything fancy, but if there's windows, they should be open, or doors, they should be open. Just some type of airflow they've found is very, very helpful in preventing the airborne nature of it. And of course, other things that we had mentioned, masks, distancing. Is it possible to do a hybrid where some of it can be done outside? These are the questions I would take into consideration. I think things such as locker rooms are kind of off limits right now. I would avoid any areas where, you know, there's congregation, close quarters. And then, of course, I would look into all the disinfection procedures and protocols, and probably would want to increase those and increase the frequency of those.
I think, yeah, that's perfect. And then also you can limit the number of people inside at the same time.
Right.
And then you do like the obvious, like fewer people, 6 feet apart, mask up when you can. This is a really interesting question. So what is the best practice for a mask after the kid starts a race, right? So everybody's masked up, right, pre-participation, but then the competition starts. They're not going to run, for example, if this were cross country or track. they're not going to maybe run in the mask. So do they put it on the table and then pick it back up at the end, or do they put it in a plastic bag or a paper bag, or is it just like you just use one and done and then you get a new one at the end? What's the thinking on this? I'm not aware of any data to support an answer. If anybody has an idea. Sasha, please.
Yeah, I mean, the only thing is the staggered starts, right? So not to do with the mask, but just to stagger the start so they don't need the mask at the start line.
Right. I mean, I know at least, sorry, for like from hospital workers, recommendations are, keeping them in a paper bag because they're more porous. Everyone has their own separate bag, to avoid, any touching of surfaces. But outside of that, I don't know any strong data either way.
Cordelia, I have a question for you because I know it's something that you always feel passionate about, and we haven't talked about it, or just for you to comment on it, is the mental health piece with our young athletes, because we haven't talked about that at all.
That's a great. So so this usually comes up because why is a big deal, right? If there's any risk, why do we even why not just say you can't do it? And right, kids reap and adults for that matter, reap so many benefits from sport participation, bone health, musculoskeletal health, cardiovascular health, but one that we don't often talk about is mental health. So, kids who are physically active sleep better, they perform better in school, their behavior is better. And so to me, if we can figure out a way to get kids physically active and back in sports as safely as possible, as quickly as possible, that is a real win. But if your question is, that was a really open-ended question.
Okay, well, listen, it was two parts, and that was certainly one part. And the other part is, just that, hey, now these are kids who have been isolated,
right?
And potentially, and and some truly are rightfully so scared maybe to get back to sport, and they have real concern, and their parents maybe put that concern on them, and they have other mental issues that need to be addressed.
I think so. I guess I would just say that I think sports, physical activity, and mental health are really inextricably intertwined. And I think that as parents and coaches and anybody who works with young athletes, I think actually, especially for the seniors who are losing their final seasons, for example, or, I think for a lot of athletes whose seasons have been canceled, that there's almost a period of mourning and loss, and that you see the loss of athlete identity, and there's the risk for depression. And so I think recognizing that can happen and trying to mitigate that, be it just finding a different modified way to participate or channeling that energy into a different interest or whatever it might be. But I think it's important. I think it's important thing to not forget is that mental health really plays such an important role with physical activity, I think, and vice versa. Does that sort of answer your question?
Absolutely. But something that we should just be alert to, exactly.
Yeah. We're coming to the end, but we've got a lot of, let's see. Sorry, we have a whole lot of questions that came in right at the end. So let's rapid fire these. Okay. Is COVID transmitted in body fluids such as sweat and saliva? Do we need to worry about exposure to those fluids during sport? I love that question. Jackie or Dennis, what do you think?
Have not seen any evidence or study that would suggest that it's transmitted through other bodily fluids.
Well, through sweat. I think saliva. I think the concern, with anything physically active, is that you're going to be breathing more heavily, right? And so potentially your, any viral particles are going to be in a bigger area. So I think potentially saliva, I would imagine. Am I wrong?
No, you're right. There can be aerosolization, and unfortunately, when you're panting, breathing hard, running, you're what we call a super spreader. So it's more likely, unfortunately, for these things to spread, especially during sports games. People get excited, they're yelling, they're cheering, and that large force coming out of your mouth can unfortunately spread things more as well.
Sweat, not so much. And blood, blood is just universal precaution. So I think sweat, blood, not so much, but saliva, I think certainly
yes.
Continue to be concerned about. All right, next rapid fire. Would you recommend league directors to send out pregame surveys to players as a screening process, or have staff take temperature checks of participants upon arriving at the field? I would probably say yes to both. What do anybody else think? Or even, yeah, and I would encourage them. So we self-report our temperatures before we even come in. I mean, ideally, if you have a temperature, you want to know about it before you come to the field.
Right.
That's a good second check as well. Anybody have somebody to add to that? We've got like 3 more. Contact tracing guidelines state that you are at risk if you are in close proximity of an infected person 6 feet or less for at least 15 minutes or more. How does this guideline apply to a contact sports scenario like basketball? I think these are the tough questions, because I think sometimes we just don't know. But any thoughts?
Right. I mean, it's all risk benefit, right? So if you're somebody who can't take that chance of being in close contact, because yes, indoor sports are higher risk. Things such as basketball, football are higher risk where there is physical contact. So it's all risk versus benefit for that individual.
Okay. Actually, that was the last one. I built it up, but so the last 2 are comments, which I will add. Again, our expert has phoned in. And so in terms of mental health, she says there's a nonprofit called Sidelined USA that can be a great resource, that they in general are supportive of athletes who've like been disqualified from a sport for a medical condition, for example, but now with COVID. Because again, you know, when I talk to my athletes who come in after an ACL injury, for example, and you know, that's really a season-ending injury. Like COVID is a season-ending event for a lot of kids. And so I really think that recognizing that really the angst that can cause, and sort of having a resource to direct kids to is helpful. So Sidelined USA. Thanks, Julia. I think that about wraps it up. Does anybody have anything else that they want to add, or things that, you know, points that we wanted to try to make that we didn't get to in our hour? All right. Well, this has been fantastic. Thank you so much for joining me and everybody else. And hopefully we can do it again. Thank you.